Hello and welcome to TNIE Online. I'm Chaitna Belgare, and today with us we have Mr. Ajit Isaac, the entrepreneur, founder, chairman of India's largest flexi staffing business service provider with more than 4.2 lakh employees, Quess Corp. Ajit Isaac and his wife Sarah Isaac are much being appreciated all over social media for their commitment to donate 105 crore for setting up a Center for Public Health and Policy Research at the Indian Institute of Science in Bangalore. The center will offer dual degrees, fund research, scholarships, and much more. Let's talk to him and find out more about it, about their philanthropic contribution and the reason behind this. We welcome you, sir.
Thank you, Chetna.
First of all, a very big congratulations for all the well-deserved appreciation from many entrepreneurs themselves, scientists, students, public health researchers, state government, and even common man. Could you please brief us a little about the Isaac Foundation itself?
So this foundation is a family initiative to channel our activity in the not-for-profit space and for objectives that have a common social good. So we've primarily been focusing on health and education. So in the area of health, we are participating to help develop a pediatric center at CMC Vellore. CMC Vellore has large facility, an existing facility which has about 3,500 beds, and they're building an additional one at a place called Kanigapuram. So along with Fairfax and Quess, we are helping to build a pediatric center where the family will also participate. In addition, we've got some assistance that we're providing to the geriatric center that the St. John's Hospital is building in Koromangala. That's another one. And the third thing is that there are various mission hospitals in India that have decayed or have become debilitated over a period of time. Prior to independence, maybe almost about 80% of the healthcare requirements of India were met by mission hospitals, but they've fallen into bad times. So we're picking up remote hospitals in tribal areas usually, and helping them to build back a practice where government and other alternatives are difficult to reach. So in places like Chungathara, Nilambur in Kerala, then in Chhatarpur in the north, and in Assam, etc., we're helping to build back capacity and infrastructure in these mission hospitals. Lastly, we have a foundation also at Quess, which is called CareWorks. At CareWorks, we aim to build infrastructure and capacity in primary and secondary schools. So there are almost about 30,000 children whose education we're supporting today through this foundation. And it's essentially to ensure that students have the capacity in terms of infrastructure to participate in education, and to ensure that the teachers are able to, to have academic resources that are sufficient to ensure students come out on top of their grade. So this is sort of the summary of stuff that we do from the Isaac Foundation.
I think that is more or less most of it, is covered, wherein you look touching upon education, health, and also pediatric health and geriatric health, which is really important, I guess, now. What is the reason? Can we know the reason behind setting up the Isaac Center for Public Health and Policy Research Center, and here that too at IISc? Was there anything, which led to this? What exactly was it?
So it was around 6 to 8 months back, I think, that initially IISc, led by its director, had a call with me to check if we have an interest to participate in their hospital initiative. They're setting up a postgraduate teaching center and a multi-speciality and a super speciality hospital of about 700 to 800 beds within the IISc complex. Since we were already involved with a hospital project at CMC Vellore, I didn't want to develop another front because we wanted to put all our energies into one project rather than dissipate it across many. But I told him I have an interest in the area of public health, and if the center would like, if the institute would like to come back with a proposal on setting up a public health adjacent to the hospital, because the availability of medical and clinical inputs from a hospital is very vital to the research work that a public health institute will do. I thought that will be, that will be a great combination. So in about 2 or 3 months' time, they came back with a very well done proposal, and more than anything else, the enthusiasm and the motivation to build a world-class institute. So we worked and iterated this a bit, and then towards November, December, we decided that we'd go ahead, and it took about a couple of months thereafterwards to get the MOU going. So actually, the motivation for us from the Isaac Foundation was actually 3 things. The availability of medical and clinical data from the adjacent hospital, which is going to be a world-class hospital, and it's already got some fantastic donors in Bagchi and Parsati. And additionally, they will develop some more. So I think it'll be a well-funded, well thought out initiative. Around the hospital, it will also have inputs of pure science and core engineering that will come from the main institute. So in some of the other larger research institutes in public health in the world, like for example, the one at Harvard, the one at MIT, etc., they've all grown through an interdisciplinary approach. And there's no such opportunity in India to develop one of this size and scale, which can compete with the larger ones worldwide, unless you set it up at IISc. So the combination of medical clinical inputs, pure science, core engineering, and big data computational capability that IISc has. Big data today is a big part of public health because, in epidemics, you're dealing with millions and zillions of data of people, of paradigms of behavior that change in the context of different circumstances, vaccines, weather, climate change, water and sanitation, sewage, etc. So to triangulate all of this and to bring about a policy and to guide state to develop governance guidelines on this needs a lot of computation ability. And that's where I think IISc stood out. And it made an easy decision. The last point is that IISc has also historically had many combinations or partnerships that is developed with private sector and individuals and donors. They already have an institute for brain research. They have another one for artificial intelligence, and they have another one for biosciences. So they have a rigor in terms of how they approach building partnerships, and that is a measure of comfort for somebody coming in as a donor.
So pandemic has literally proved to us that we need to be much ahead in terms of research, especially, and not just ape whatever is coming from West, but we also contribute to that. And I think we have been doing really good in terms of research for that matter. And IISc is definitely a great game for that. Can you know a little more details on how the center is set to be operational by 2024? So can I know how it will be funded? What exactly will go behind it, just to understand the logistics of it?
So there's a Center for Academics and Research being built adjacent to the hospital. It's a 5-story structure with, I think, a floor plate of approximately 27,000 square feet per floor, which is being funded by a large corporate in India. So the 6th floor will be built by our foundation, which is about 27,000 feet again. And in addition to the construction costs that will come in, we'll also fund the creation of the labs, the physical infrastructure, the library, the information center, and everything else that goes into the public health institute. In addition to this, we'll also create endowed chairs where we'll get people to come and work here who are specialists in this from outside India and also from India at competitive compensation, so that we're able to attract the best. We intend to take about 10 PhD students every year, and hopefully this institute will also be able to give dual degree programs where they're able to give a PhD and an MD, or let's say an MTech and an MPH together. So it's a combination of science and a public health degree that they will get. So it's only one of the few that will be able to do that. We'll also have to fund students for internships. We'll have to fund students who want to go and work, let's say, for a specific period in an international institute where the Isaac Center for Public Health will perhaps develop relationships, and also bring in faculty internally when necessary from outside. So it will go to fund infrastructure, the provision of academic support, research and internships, and actual field projects. Field projects, for example, diabetes and other chronic diseases, need a lot of field support in terms of data gathering and actual field level data capture that will help this system, that will assist the creation of policy. So it's a 360-degree approach, therefore, to the institute. All of this will come across 4 to 5 years' time, and we hope that in 5 years' time, this will be a self-supporting venture.
So has there been any important public health sectors which you think that we need to really look into now? COVID has taken taken the focus away from the lot of other things like non-communicable diseases and those things which actually need a lot of attention. So is there anything in particular kind of chosen for, or is it just going to be left with the IISc to decide on that?
So the IISc has... they've shortlisted rather a set of 6 projects that they'd like to pursue. And it's best that you talk to them to know the details of those projects specifically. But I can say that these projects will cover chronic disease areas of India. For example, diabetes and cardiac care are two instances which we necessarily have to investigate, because India is sort of the diabetic capital of the world, and it further leads to other chronic disease situations. So, and cardiac situations is also emerging very rapidly as among the top 3 killers in India. So these 2 areas will definitely cover, and a few others that the institute is investigating and developing. So while they will give you more light on this, also it should be noted that this institute is born in the middle of a pandemic. It's a once in a generation sort of situation. So to be able to analyze the effects of the pandemic, I think the long COVID phenomenon, as many people have been talking about, is going to be a bit of a nightmare, in terms of what it will cause, because I think we're still very early into the effects of the pandemic. So I'll take us some time to actually analyze what it's going to cause. Mental health related issues is also going to be a big thing, because working from home and lifestyle changes is causing people anxiety in many different ways. So I think the center will have its plate full in terms of
much needed. Yes. Indian government kind of spends only about 0.7% of its GDP on R&D per se. And when you compare it to 2% spent by China, or about 5% spent by Israel. And so how important do you think it is to contribute towards research? When if people like you, philanthropists who want to contribute, how much of importance do you think it is to contribute towards research?
So, there are 2 points here. One is that if you take pillars of governance in any society, they actually come around law and order, the financial institutions, and lastly on public health. If these 3 things are largely in place, governance in society is considered to be, more or less in place. Law and order is the absolute realm of the government. Financial institutions has a regulatory system to ensure that everything falls in line. It's mostly a public and private initiative that can drive it. So to that extent, I think it's important that private citizens and organizations step up and do participate in creating capacity in dealing with health-related matters in society. On the other side, health as a percentage of GDP in India is also very low. It's, I think, 1.2%. We're aiming to get it to about 2.5% by 2025. So the combination of what you said, the low R&D and the low health share of GDP in health, is a potent combination, and we'll always be looking for solutions from the outside. So I think in institutions like IISc will contribute a lot. It's the only institution from India in the top 100 in the world, and I think we can, if foundations like ours come forward and participate with them, we can actually show the way in terms of how we can create original funds of knowledge. As a last point, the AstraZeneca vaccine, which many of us would have got actually, the Covishield one that's administered in India, was originally researched and developed in the research labs of Oxford University. So universities play a big role in healthcare and in original areas of research in healthcare. And I think it's important that private sector step up. Be happy to see if many more of these institutes come up. I think India needs at least 3 to 5 such world-class public health institutes. If this can become one of them, I think it's acceptable outcome to the whole process.
And it's quite interesting that your contribution, like you said, that you were approached, and then there was we had Mindtree co-founders Subrata Bagchi and Partharthi, who donated 425 crores for the same institute for setting up a multi-speciality hospital. So is there like a growing trend of first generation entrepreneurs like you contributing back to society through such funding?
Well, I think 2 things are happening. One is with capital markets growing and the ability to find liquidity to some of the enterprises that entrepreneurs have invested in, clearly there's a trend to give back part of that harvest back to society in some way. One. And second is, I think there's an increasing awareness that the development of India cannot just be funded by state resources alone, but by reasonable contributions from private citizens. If you take the United States, I think there are 60 odd universities with endowments in excess of $1 billion. So if you ask me, what contributed to America's growth, maybe it's 3 things. It's investment in infrastructure, it's private citizens' investment in education, and lastly, it's capital markets. And of course, underlying all of that is the democracy that goes around that,
Yeah.
So if we are able to therefore put more money back into education, and when private investment comes into education, and if it's not for profit, I think standards will go up. We're already seeing great examples in the ISB school at Hyderabad, in the Ashoka University in Delhi, then which is, I think, a great liberal arts center right now that's growing. And then we've got the national law schools that came up on its own almost, and that contributed an entire generation of law professionals to India. So I think there will be more and more of entrepreneurs hopefully coming back to give money back to social causes, and particularly to health and education, which will raise the standards in society.
Any more such contributions on the line of Isaac? I mean, in the bank of Isaac Foundation that you would be interested to? Just curious to know if there is anything lined up next.
Well, not immediately, because we like to, get after these 2 or 3, and we want to pursue them. But one area that also has an interest in me is sport.
As I know you're a football lover, I've read. Yeah.
So I've been tracking a few of our Indian athletes, and we've identified one. We're not yet in a position to talk about it, but somebody who potentially has some Olympic capability at some point in time, if trained, and his outcomes are good. He's about 20 years of age. So typically by about 26 to 27 is when they mature as athletes. So we've got 5 years to take it to fruition. He's about maybe 30% away from the readings that's required to get him across the medal finish line. So I'd be happy to see if I can identify 2 to 3 such people, and then work with them to see if we can make winners out of them. Always, sports is an indication also of the health and economic well-being of a nation. As nations become more prosperous, you'll find them doing better and better in sports. So health and education's outcome is also greater capability and winningness, so to say, in sports. So that's another area that's of interest to me.
I think Karnataka, there's hundreds of them who are really looking forward for such an initiative. I think it would be much appreciated if there's hundreds of players whom I have spoken to myself. I'm also interested in sports, so when they themselves have told that we need this kind of contribution coming from some entities. So I think that would be wonderful if Karnataka also can be looked into. When you're thinking of this. And though I'm not a business correspondent, I'm very curious to know a few things about the job situation now. Since I've got you, I think I should ask you, considering that we have now seen 3 waves of the pandemic, we have the 4th one expected. Are things picking up on the retail and logistics side? And if you can just give us an overview of the business and recovery you see today. I know that Quess Corp has done really well, and it's kind of, I've seen some of the numbers, and so much I can understand. But what is the situation like?
So there are a few industries that have contact and touch, in a sense. Retail is one, hospitality is another, tourism is another, manufacturing to a certain extent. So all of these are slowly coming back. If the employment numbers in Quess Corp is an indication of where the industry is. Before the first wave of the pandemic, we had 360,000 people working for us. After the first wave, that number dropped to 290,000 also. It's almost about 60, 70,000 of our workforce we lost in the first wave. But I think India grew through that into the second wave, realizing the importance of keeping business enterprise also open, because livelihoods are important. And a complete lockdown may not suffice in the manner that we looked at in the first wave. So through the second wave, actually, business has been picking up some momentum. We right now have about 420,000 people. Obviously, it's been not only caught back up to 360, but we've increased our headcount. Some of it may come from getting market share from competition, but I think overall it will be correct to say that Indian economy has picked up steam again. One. Second is, there are other dimensions, though, to employment that we should not neglect. For example, female workforce participation has come down through the pandemic.
Yes.
About, let's say, 12, 15 years ago, female workforce participation was closer to 30%. Estimates say, although they are not completely, accurate to say, but our estimates say that female workforce participation may have fallen to the high teens also through the pandemic period, which means almost half women who are working considered at least taking some time off from work to attend to family-related matters. So it's now back up to the mid-20s, I'm told, but still only 1 out of 4 women who should be working, if they're working, is not a good sign for any developing economy. And you cannot get GDP growth at the rates at which you want unless women get back to the workforce. So that's one point. The second point is, recently you would have heard about the railway entrance process that was there in Bihar, where they had about 35,000 jobs and there were 1 crore 25,000 applicants, 25 lakh applicants on that. So if that's an indication of unemployment, unemployment in India can actually be closer to maybe 4 or 5 crores of people at least, which is 40, 50 million people and a workforce size of about 230 million people. So unemployment is a serious matter, and combined with the fact that educational institutions have been stymied in the last couple of years, people have not been able to take courses, especially if they're not the degree type, etc., because institutions have been shut. You'll find people who are capable of working but not completed a course and waiting to do something to come back into the workforce. So I think we have to put more policy time and policy investments into creating of employment in India. And that's going to be key to ensuring that the generation that we are adding almost 10 million people every year to the workforce, so that they should be finding employment as we move along.
I think that's a very valid point, because instead of staying in denial, it's better to probably accept that we are going to, I mean, there is a rise, like you said, we can see a certain kind of, it is kind of limping back to, I wouldn't say normalcy, but at least we are there, getting there. So hopefully we up this too. It was wonderful talking to you. Is there anything which you want to share about either the foundation or any other aspect which you would want to tell, which I have not asked you? Anything in particular, sir?
Just the one point is that we like to attract the best talent into the center, obviously, and we look forward to people. We've already had our first candidate who wrote in wanting to do a PhD with us. So, it kind of created some traction. We look forward to both on the faculty side and students who have an interest in public health and would want to be associated with an institute of this caliber to write in and talk to us and to the institute, obviously, and we'll be happy to assist with this process. Thank you for the time you took today and enjoyed talking to you.
Thank you. It was really wonderful having you and talking to you about, we've probably covered everything, which is more important today, whatever is needed. And I hope the research center really helps thousands and lakhs of people in the country and abroad. Thank you so much for watching, and thank you for this time. So thank you.